If you've been diagnosed with mild sleep apnea or you're pretty sure you have it, this video is for you. Mild sleep apnea is one of those in-between diagnoses that doesn't get talked about enough. You're not bad enough for emergency level treatment, but you're also not sleeping well. You're tired during the day. Your sleep tracker keeps telling you something's off. Maybe you snore. Maybe you wake up with headaches. Maybe you just never feel fully rested, no matter how long you sleep. And then you start looking for answers, and everything online seems to jump straight to CPAP machines. Masks, hoses, machines on the nightstand. For a lot of people with mild sleep apnea, that feels like too much. And honestly, sometimes it is. So today I want to walk through the best devices that actually make sense for mild sleep apnea. These are realistic options backed by real data, used by real people, and designed for people who want better sleep without turning their bedroom into a medical setup. Quick disclaimer before we get started. I am not a doctor. This is not medical advice. Always talk to your sleep specialist before starting or changing any treatment. What I'm sharing here is based on research, clinical studies, and real-world use. Let's start with what mild sleep apnea actually means, because that context matters. Mild sleep apnea usually means an AHI between 5 and 15. That means your breathing is interrupted or restricted 5 to 15 times per hour. Enough to fragment your sleep and stress your body, but not always enough to trigger aggressive treatment recommendations. In many mild cases, the problem isn't your lungs, it's your airway. When you fall asleep, the muscles in your tongue and your throat, they start to relax. And for some people, especially those with certain jaw shapes, tongue positions, or muscle tone, that relaxation causes partial airway collapse. Airflow drops, oxygen dips slightly. Your brain wakes you up just enough to breathe again. You might not remember waking up, but your body does, over and over and over again, all night long. That's why most mild sleep apnea devices focus on either moving the airway out of the way or strengthening the muscles that keep it open. The most common option people hear about first is a mandibular advancement device, often called a MAD. These are mouthpieces that gently pull your lower jaw forward while you sleep. By moving the jaw forward, the tongue is also pulled forward, which helps prevent it from collapsing backward and blocking that airflow. For mild sleep apnea, these devices can be very effective. One of their biggest advantages is that they work immediately. Many people notice reduced snoring and better sleep the first night they use it. They're also relatively simple. No machines, no electricity, easy to travel with. Many are eligible for FSA or HSA reimbursement, which helps with cost. You can buy some over the counter, or you can get a custom one made by a dentist. Custom devices tend to fit better and last longer, but they're also more expensive. The trade-off, though, is comfort and long-term use. Some people adjust quickly. Others deal with jaw soreness, tooth discomfort, or their bite changes over time. And it's important to understand that this is a nightly treatment. If you stop wearing it, the apnea usually comes right back. For people who want immediate results and don't mind wearing something every night, mandibular advancement devices are still a very common and valid option. Now let's talk about the option that has really shifted the mild sleep apnea conversation in recent years, and that's Excite OSA. Excite OSA works completely differently from most sleep apnea devices. Instead of treating the airway during sleep, it works during the day. It's a tongue muscle stimulation device designed to strengthen the muscles of the tongue and upper airway. The idea is simple but powerful. If those muscles have better tone, they're less likely to collapse when you fall asleep. You use the device during the day for short sessions, 20 minutes at a time for 6 weeks, then move into a maintenance schedule 2 to 3 times per week. This device is FDA cleared for snoring and mild sleep apnea, and it's supported by clinical studies showing reductions in snoring frequency and improvements in AHI for mild cases. What makes this option stand out is that it doesn't involve wearing anything at night. There's no mask, no mouth guard, no equipment when you're trying to sleep. For a lot of people, especially those who hate nighttime gear, that alone is a huge difference. Now, ExciteOSA does require a prescription, but the process has become much easier through Spring Sleep, which is now the US distributor. They handle the telehealth consultation directly, and in many cases, you don't need a full overnight sleep study to get started, especially if you already have a diagnosis or documented snoring issues. Another important shift to note is support. Earlier versions of this device had mixed reviews around replacements and customer service. Since Spring Sleep took over distribution, that side of the experience has improved significantly. Like prescription meds, this is not the cheapest option up front. However, it is FSA and HSA eligible, which can significantly reduce the out-of-pocket impact. This option tends to work best for people with tongue-based airway collapse who want a solution that focuses on training rather than lifelong management. Another category worth mentioning is positional therapy. Some people only experience sleep apnea when they sleep on their back. If your sleep study shows that your AHI drops significantly when you sleep on your side, positional therapy can be extremely effective. Modern positional devices gently vibrate when you roll onto your back, encouraging you to shift positions without fully waking you up. Over time, many people naturally train themselves to avoid sleeping on their back altogether. This is often one of the most cost-effective solutions, but it only works if the position is truly the main trigger. Then there are nasal and EPAP-style devices. Nasal dilators, whether adhesive strips or internal supports, can help reduce airflow resistance if nasal collapse contributes to your symptoms. These are simple and low risk, but they usually work best as a supplement rather than a standalone treatment. EPAP devices create resistance during exhalation, helping keep the airway open. Some people with mild sleep apnea do well with these, especially for travel, though the sensation can take some adjustment. So how do you decide which option makes most sense? If you want immediate improvement and don't mind wearing something at night, a mandibular advancement device may be the right place to start. If you want to avoid nighttime equipment and are willing to commit to a short training period, ExciteOSA through Spring Sleep is one of the most compelling options currently available for mild sleep apnea. If your apnea is clearly positional therapy may be all you need. And if your symptoms are very mild or situational, nasal or EPAP options may be helpful, especially alongside lifestyle changes. The most important takeaway here is that mild sleep apnea still deserves treatment. It doesn't mean you should ignore it, and it doesn't mean you automatically need a CPAP. You have real options now. The best device is one you'll actually use consistently and comfortably. If you want a deeper dive into comparisons, reimbursement options, or long-term outcomes, let me know in the comments. And if this was helpful, subscribe for more realistic, no-hype sleep content. Sleep should improve your life, not complicate it.